Hey, Miesha, how are you?
I'm great. How are you?
I'm good. How's your day going?
Very, very well.
Very
So excited
good.
here, finally.
I know. So excited. Thank you so much for coming on. I appreciate it.
Thank you too, Dr. O.
Okay, so I will give everybody just a couple more minutes to come on and then we can get started, okay?
Beautiful.
Love the plants in the background.
Oh yeah.
Okay, good. All right, well, let's get started, okay? So everybody, my name is Dr. Achama Osei Tutu. I am a board certified dermatologist practicing in New York, but my love and passion and joy is hair loss. And so I think if you are a dermatologist serving Black women, you have to be well versed in hair loss because it is such an epidemic in that population of patients. In addition to that, I do have a lot of family members who also suffer from hair loss as well. So in my quest to find an answer for them, that's one of the other reasons why I got interested in hair loss. And of course, as a Black woman, I've had my own issues with, loose edges, right? Like we all have,
Yeah.
right?
I'm so glad that you decided to study this because, I'm literally bowing down to
Ah,
you every day. And I think you know that. Look, so many women on this call, I'm sure, can relate. So,
exactly. So let's talk about the reason for this whole live in the first place, right? So number one, as I stated before, this is an epidemic. So I want to ring the alarm bell like so many of my derm sisters have done in the past. And I want to let people know that they can go to the dermatologist to get help and not to hide in shame and leave it until the end. I see so many patients coming to me at end stages, and a lot of the times I have to tell them that there's absolutely nothing that I can do to help them. So it's really, really important that people recognize that they have a problem and come to the doctor as soon as possible. All right? So let me introduce my fabulous, beautiful, gorgeous guest. So this
thank
is my,
you.
my patient, Miesha, and we've been through a lot together, right?
Yeah.
Thoughts, right? We have done a lot together. And, she came to me with traction alopecia, and we walked her through her journey with natural hair. We walked her through transplants. We walked her through a diagnosis of CCCA. And so I'm honored to have you here today to really talk to everybody about some of the things that we talk about all the time in our office. And so this is going to be a conversation between girlfriends who happen to be patient and doctor. So why don't we get started? Ready?
So I did keep some notes so that I didn't forget anything. So if you see me looking up, I'm just looking
It's
down.
all good. All right. So talk to me about how you wore your hair when you were young Miesha.
Yeah, young me. Like most Black girls, Black little girls, I wore cornrow styles, ponytail styles predominantly. Um, and actually, very early on, my edges started to reflect those styles as
Mhm.
early as like 10 years old. I remember once for like a party, my mom let me wear the back of my hair out, and it totally betrayed me by the end of the night. It was a shrunken, brillo-y mess. So
Mhm.
early on, I never thought I didn't like my natural hair.
Sure.
And I never thought I could wear my natural hair out. So it was always those braided styles or ponytail styles, and my edges started to pay for it quite early on.
So why do you feel like your hair didn't necessarily look nice to you? Like what was it about your hair that you didn't like?
So clearly, I totally feel differently about that today.
Oh, let's yes.
Uh,
Hello.
but it's interesting because back then I never ever saw, either in real life or in magazines or on TV, Black women with natural hair with my texture worn in its natural state to show or to be featured as beauty, a
Sure.
beautiful thing.
Of course.
So it and then when I actually did try to wear my hair out, it didn't look like what how I saw Black women wearing their hair.
Right. And I think, you had mentioned previously about you starting when you were 10. A lot of times when patients come in, even if I'm not seeing them for hair loss and I see a little girl with her hair maybe pulled a little bit too tight, you know, I will say something, you know, we don't need to snatch everybody's edges up, right? I think we all need to get out of this thing that our edges need to be completely neat and tight, because that definitely will set us up for problems in the future. So we all just have to be really careful.
Yeah.
So let's talk about your positive and or negative reinforcements that you got for wearing your hair out in natural when you were younger.
Oh, I didn't have any. No positive reinforcements for wearing my hair out. My mom, my grandmother, my aunt, they all had beautiful hair, just gorgeous, like flowing, thick, healthy hair, actually, even though it was chemically straightened.
Right.
And that was my model for when I was old enough and I would wear my hair out, it would look like theirs, right? And so, you know, fairly early on, I begged for a relaxer. Got one probably way too early than I should have. But nobody ever said anything overtly negative about my hair.
Sure.
But, you know, my cousins who had a looser texture, one, they got to wear their hair out,
Sure.
and they were constantly told how pretty their hair was and how they had good hair. So by inference, I guess I had not good hair or, you know, bad hair.
Right. Right. So that's a very interesting point. I think that, you know, we get all of these little digs, and, you know, the word microaggression is really popular right now. So I'm gonna, you know, jump on the bandwagon. That really eats away kind of at our hair soul. You know, we get so bogged down by thinking that we should have a certain type of hair that we spend our lives manipulating our hair into that sort of perfect ideal. And again, that's going to set us up for problems in the future. All right.
Those what you just said, Dr. O, is totally resonating with me. These microaggressions, or, you know, these little digs, right? Because today I feel very differently. Today, for me, beautiful hair has nothing to do with texture or length.
Absolutely.
For today, it's all about healthy hair. And if you think about the women that I see on the street that I do a double take on, it's just their hair looks healthy.
Absolutely.
And that them to me look beautiful.
Right. Absolutely.
Yeah.
So now let's get into your actual hair loss journey. So when did the hair loss start? And, you know, I know you mentioned that it was little, but when did you really start to pay attention to it?
Oh my God. Okay. So, you know, probably around 10 years old, edges were being a problem. And then probably by around 11 years old, I got a relaxer.
A relaxer.
A relaxer. And, you know, we stayed in the salon. Okay. And very early on, you know, I started having issues with just chronic breakage and hair thinning and my edges disappearing.
Yes.
Honestly, it felt like my mom and I spent just about every weekend in the salon to get deep conditioning treatments and to cut my hair to try to make it look better. It honestly felt like an all-consuming job. It was, and, you know, at that age, I should have been in ballet, dance, piano, and instead I'm chasing hair. You know, this was not a good situation.
So when did you decide that, all right, I've had enough. It's time for me to see somebody professional? Why did you decide to go to the dermatologist?
You know, it took a long time to get there. It never, ever once occurred to me or my mom in that, let's say, 7 years from the time I was like 11 till the time I went to college at 18 to seek help like that.
Sure.
Went to salons. We just lived in salons. Then when I was in college, I discovered extensions braids.
Sure.
And I thought that that was very fashionable. I liked the look of it. And it actually allowed me to let go of this obsession with trying to fix my hair so that I could actually focus on my studies. So it was actually a very freeing thing. A positive side effect to that was that no more minimal manipulation and no more relaxing caused my new growth to blow up. It was growing like crazy. And so, but my edges were disappearing. And so at some point, I mean, I still was going for my relaxers between, you know, stretches of nothing.
Were you getting breakage in between in between the braids? Were you still
No, I was doing well with the braids.
Okay.
Weren't doing well. My hair was doing well with the braids, but then after, let's say, no more relaxing for 6 months or 1 year, and then I go back to my creamy crap because I liked it, right? And then I go through the cycle of breakage again. So the braids became a way to sort of, one, not have to deal with my hair and let it rest and recover. So it should have been a red flag that, Miss Honey, your hair doesn't like these chemicals, but I never thought I had another option. Then, you know, fast forward to closer to present day, and, you know, there's more positive images of, you know, natural hair, and it's you know, these natural hair bloggers are popping up and teaching you what they're doing and showing you about products and that kind of thing. So I got somewhat intrigued, but I still was committed to my relaxer, but I needed to get my edges right. So I had somehow heard about steroid injections for hair edge damage from, say, traction. So that's how I got into your care, thank God. And so we started with treatment with, you know, steroid injections and Rogaine and that sort of thing for my edges. I was still, you told me not to, but I wasn't ready yet.
So why didn't you stop braiding? Because let me bring up two really important points. First thing is that for some reason, people don't know that they need to go to the dermatologist when they're having a scalp issue, right? We all have breakage, and most of the time breakage is just breakage. You're probably not grooming your hair properly. You know, you have an issue with just the shaft. But if the hair breakage is recurrent, if you're starting to have symptoms on your scalp, itching, burning, pain, if you're starting to have a bald patch, you need to go see the doctor, because your scalp is telling you that there is something wrong, right? There is no lotion, potion, Jamaican black castor oil, rubbing, scrubbing, massaging, inverting your head upside down that is going to fix a problem. You need to get a diagnosis, and you need to figure out what's going on with you, right?
Agreed. And you know that comes later for me, where I started having burning and itching and that kind of thing. But initially, it was just my friend.
Okay.
Yeah.
So we started treating you with cortisone injections, right? To decrease any inflammation, because in traction, we know that there's a range, right? There's a range of traction from reversible to irreversible. Typically with reversible, you stop engaging in traction type behaviors, and then the hair comes back. Irreversible, your hair is smooth, shiny, and bald, and you need a hair transplant. In between that, you probably have rescuable, I call them rescuable hair follicles, which means that there are multiple things that can possibly bring the hair back. Anything from natural to platelet-rich plasma to some of the medications that we give. And there was actually a study published recently that showed that cortisone injections were actually really helpful. So we did standard of care, which is cortisone injections, Rogaine, a topical cortisone, and tell me what happened with that.
I had some improvement, but I mean, you know what my before situation was, and some of you who've seen your website, your Instagram, know what my befores look like. It was a lot, and so it helped some, but it wasn't moving, not necessarily fast enough, just enough. We kind of stalled at some point.
Sure. So then I recommended to do a hair transplant, right?
Yes.
So I think it's really important when you are examining a person and trying to decide about a treatment regimen for traction alopecia, you got to get your dermatoscope out and really look to see what the follicles are doing, right? If it's completely scarred down, don't waste your time doing injections, because nothing is going to bring that back. Don't waste your time even doing PRP, because you actually need a functioning follicle underneath the scalp in order to produce this. So if it's smooth and shiny, none of that stuff is going to be helpful, and you're going to a transplant at that point. So we decided to do a transplant, and talk to me about the transplant. How did that go?
The best thing ever. You know, it was actually quite fine. I think I don't remember feeling nervous or anything about it. The day of the transplant, you shaved the area that you were going to harvest from, and then injected the area with numbing medicine, and that was uncomfortable. But anybody who's had injections in their scalp knows what that feels like. It hurts, yeah. So that was the only uncomfortable part. Otherwise, you know, I was completely awake for the whole procedure. We were talking, chatting throughout. It actually was very comfortable. I had no issues. It took a few hours. I went home. 10 days later, I had to come back so you could remove my sutures. And that was also.
Let me just say, somebody just asked FUE or strip. So there are two kinds of transplants that we do. One is called a follicular unit transplant, or FUT, or strip. And then the other one is called a follicular unit extraction. So with the strip, we basically cut a strip of scalp from the back of your head, usually about, 1 centimeter, 1.2 centimeters. We cut that down to the fat where the hair follicles are. And then we take that strip of scalp and then we dissect it into the little individual follicle units. And then we place that back into the area of concern, right? In your particular scenario, in the front. With the FUE, or follicular unit extraction, we take some sort of tool, whether it be manual or mechanized or robot, and we take the hairs individually one by one. Now you have to shave a lot more of the hair with the FUE. So for some people, it might be more of a problem. For some women who like to have, who like to grow their hair. And then the same way that we place the hairs back in the front, we do the same thing with FUE. So why might one person choose an FUE versus an FUT? So FUE, if you at all want to wear your hair shaved down, because, I like to switch up the do a little bit. This is actually the longest my hair has been in a minute. If I ever shave my hair down, then I'm going to want to do the FUE possibly, because you're going to have a strip scar. Typically, the strip scar is, thin, but you're going to be able to see that, right? The other thing is the supply and the demand issue. I often find that with my patients, they have a lot of hair loss and I need to get a lot of hair, right? And so I find for me that the strip is a little bit better. We do have to be careful with the strip because, again, often in my patients, there's other hair loss conditions going on. So we're always looking to make sure that the donor area, which is the back of the scalp, is in relatively good condition. All right?
When you do the FUE, is there scar?
No, that's not true. Anytime you cut, there is a scar. So the scar is just distributed in the back of the scalp in little tiny dots. And in some people, you can actually see the dots, right? Depending on how you scar. Some people may get slightly hypertrophic or slightly thickened scars, but usually it's just like little white dots that are coverable, so you barely really see it. The strip surgery takes about, it depends on how much hair we have to transfer, but it can take anywhere from like 5 hours to 10 hours, just depending on how difficult the case is.
Well, I know
yeah.
And for me, so you cut a defect out, but then you suture it.
Absolutely.
So I know when you look in my scalp, you have to really dig because I have a lot of hair, but you dig and you can find, where you did your procedure. But I've never ever had, like, if a stylist were doing my hair, or even if I touch myself, I don't feel anything. And I don't even feel like it's any thinner in that area personally. So I chose this for me.
Somebody asked if it was advisable to do a hair transplant on sparse areas of the crown with female pattern hair loss. If you have diffuse female pattern hair loss, you're probably not a great candidate for hair transplants because you do have to have a good donor, but it depends on so many different factors. So you should just, try to go see a hair transplant surgeon to help you determine if you're a good candidate or not. Okay, so tell me about what happened after you did the transplant.
You transplant. Later, I came in for the suture removal. That was a little unpleasant. So the 2 times I experienced any pain or discomfort was in the numbing initially, and then in the suture removal. The day of the procedure, when I came home, I did take pain medicine for 1 day, and not because I had any pain. I just took it like every 4 or 6 hours just to stay ahead of the pain, and I never had any pain or discomfort. I will tell you, initially, it feels like you're watching paint dry, right? Because, I'd be looking and looking and looking, but by 3 months, and I was also taking pictures and sharing that kind of thing. And by 3 months, there was a noticeable improvement. And by 6 months,
right?
Yeah. I couldn't believe it. I'm, so happy. Because if you think about it, this was something I had been struggling with since early childhood. So, and if you remember, when we decided to go for the transplant, you told me that you wanted me to stop relaxing after that.
Yeah.
And if my edges came in, then I could, because my hair covered my thin edges,
Sure.
right? So personally, I didn't think I could go natural until I dealt with my edges. So by the time you did my transplant, I was very ready to transition to natural, and I did. Now, you know, I use braids, my trusted braids, to transition, to grow out my relaxer, and then 6 months later, I did my big chop.
A comment about men and transplants. Yeah, I would preferably do an FUE on them just because of the strip scar. And somebody asked about CCCA and transplants. You can completely do a transplant on CCCA patients with caveats. You have to be really careful. It depends on the area that needs to be transplanted. You should be on medical therapy for at least a year before you do the transplant. And we really just take it on a case-by-case basis. If you have a huge area of hair loss, and typically CCCA or central centrifugal cicatricial alopecia does not just affect the middle of your scalp. I often see it in various parts of the scalp. I'll even biopsy the back and the side, and there will be some inflammatory lymphocytic infiltrate, which is what typically the CCCA biopsy shows. So you got to really make sure that your donor area is optimal before you go ahead and transplant that. But you can do them in certain situations. Okay.
I saw somebody write something that said they have low self-esteem about their hair or something like that. I just want to say something about that. It's kind of hard for me to talk and be reading these comments. Yeah. I did see that one, and I just want to say something about it.
Oh, I didn't see that.
I feel like I was there too. And I feel like a lot of us probably were. I can share with that person that what I did to try to get to the other side of things was, like I said, we didn't talk about this. You and I talked about it at the beginning, but I started using Instagram and you know, the internet, just Google, or Pinterest or whatever these platforms are where people post pictures, to start to curate pictures of Black women with beautiful hair and beautiful natural hair. And I have this whole photo album on my iPad with all of these pictures, and it helped me to sort of think about where I could go, you know, and bless you.
Thank you.
Have a plan for what I wanted to do and maybe how I could get there. So I would encourage that person to maybe start there with just images of people that you find striking, or people that maybe you have you maybe look like them, or what have you like their style or whatever, and see if you can imagine or figure out how to get there. So I started with the end result in mind, and then tried to figure out how to get there. And it was a process. You know, I had setbacks with my
yeah. Thank you. That's actually a really, really good tip. That was really good.